called? Both the fascia and Chinese medicine we found combined together very, very well. And a lot of times when I try to understand how scalp acupuncture works, in one just out of the day conversation with Gilad, and I said, okay, maybe this is the connection how scalp acupuncture works with we're working through the fascia. And so today, after seeing how we can actually teach more, because scalp acupuncture is more, the terms are more westernized. So actually here, I thought it would be a great opportunity to bring Gilad and to speak more about the fascia. Every now and then I'll butt in maybe to speak more about how what he speaks about combines with Chinese acupuncture, bringing the Western theory with the Eastern theory together. So we have East meets the West here. So I hope you enjoy it. With that, I will give the speaker to Gilad, and he will go from there.
Okay. So thank you, David. Hello, everybody. As David introduced me, I'm Gilad. I'm a physiotherapist. I'm not so I don't have a lot of experience as a physiotherapist. I'm a physiotherapist only a bit more than 10 years, but in Israeli matters or as a physiotherapist, most of my practice is fascia practice. I studied fascial manipulation, and this is mainly what I do in the last 10 years. I really like this this material, and I love to search it and to understand things through the eyes of the fascial manipulation or the fascia system. And I'm sorry for my English if somebody doesn't understand me because of my English. So please wrote a question for David, and he will ask me. And if somebody doesn't understand anything because of the knowledge, the material, so please don't ask because I won't be able to answer it. I'm joking. Just ask David, and we'll try to understand together. So actually, the purpose of our conversation now is, as David said, is to try to build a bridge or a connection between the maybe Eastern medicine or maybe scalp needling or Y.N.S.A, and to understand it through Western eyes or through fascia, which is a connective tissue. It's an anatomical component of the human body. And I think that through this material, through this tissue, we can understand a lot of things that are in a lot of fields are considered to be like a mystery or something that we cannot understand, or things that in Western medicine, the physician, the doctors doesn't know how to explain. So let's get started, and feel free to ask questions. So what is fascia actually? Well, it's a connective tissue. All of you know it, and it's actually it's a tissue that envelopes every organ in our body. It's like I like very simple examples. So please excuse me for simple examples. You can take a hot dog or a sausage, for example, and there is a sleeve that holds the meat inside. So the sleeve is the fascia, is holding the organ inside. And this fascia, it envelopes every organ. Internal organs like liver or stomach or brain, muscles, bone, nerve, blood vessels. It envelopes every organ in our body. Actually, this is the material that gives the shape to the organ. Because if I would take the fascia out of the muscle, it would be just like pieces of something that doesn't hold itself. So the fascia gives the muscle its shape. Also internal organs, also the brain, every organ, it's like that. What I'm saying is a pure anatomical explanation. It's not a theory. It's something that is in the body. Just 1 minute. This the fascia actually gives the organ also the shape, but also sorry, 1 minute. Also the ability to move for every organ. The movement is in two planes, actually, in two ways of moving. One way is the organ that moves regarding to other organs. For instance, if there is a lady that is pregnant, so the womb is getting bigger and the liver is getting to the side and the duodenum is going to another way. So the fascia allow the organs to move regarding to each other. That's one way. And the other way is the movement of the organ itself inside, like the peristaltica of the digestive system, for example. The fascia, the structure of the fascia is actually 3 layers that goes above each other, and there is a lubrication material that allows the layers to glide upon each other. This material is, most of you know it, it's hyaluronic acid. This is the lubrication material of the body, and it's in between the layers. In some situations, this material, the hyaluronic acid, which is act like soap or like oil, becomes a bit thick, but a bit like maybe honey. And then the movement between the layers is a bit stuck. And then you have adhesion in Western eyes or stagnation in Eastern eyes. And that creates some problems in the system. We'll get to it. But the most, I know it's the most, but one of the most interesting things about fascia is that it's a continuous tissue. Okay, that means that all the fascia component, all the organs actually are in connection with each other, because this is a complete organ. What I mean is that what envelop my calf muscles in my leg actually connect to my stomach, because everything is in connection, not as a concept, not as a new age concept or something, but as a real anatomical fact. You can ask a lot of fascia researchers around the world. In Italy, you have one of the best anatomical researchers, Carla Stecco, that's her name. She's the daughter of Luigi Stecco, is one of my teachers. You can find it in a lot of research. This is actually something that really blew my mind, because I believed in this concept as a person, but to see it in my eyes, it's something that blew my mind, really, to understand that everything is in connection, but I can see it with my eyes in the dissection room. I can see it in the body for real. So if I do something in my palm or in my scalp, I can influence something in another area of my body or another function of something in the body, which you all know that it's possible. But now I can understand, with these eyes, I can understand why does it happen.
So I'll just, Gilad, butt in for a minute.
Yeah.
So if we understood, listen to what Gilad is speaking about, the fascia, that it actually covers the whole body, and we go back into the first year in Chinese medicine, when they speak about the channels, they speak that one of the things that the channels does, it connects between organs, connects between different parts of the body, and it's a communicational network. And also by this communicational network, it influences different parts of the body. So you can see that already, the connection between the Chinese channels and the Chinese medicine. Like if you go 30 years ago and ask you what was a Chinese medicine, oh, I remember when I was in high school, oh, it's this energetical force that runs in certain layers of certain channels or certain roots, but you can't exactly see it. But when you have the explanation now of fascia, you understand that these channels and these roots, you actually can see them in all the planes. And like Gilad said, it connects also the musculoskeletal system, also to the bones, and also to the organs. So this connective tissue is also, in one way, you can see of the tendinomuscular meridians, that it actually connects also to the, when I thought about tendinomuscular meridians, the first thing I used to think was about the musculoskeletal system. When you start thinking about this musculoskeletal system, tendomuscular meridians is tendor, muscle, wherever you have a tendon, wherever you have a tendon, a ligament, and that it connects. So that means it also goes deeper inwards towards the organs. So you see that already, the connection also not only a connection between the musculoskeletal system, but also the internal organs, and also the functioning of the internal organs accumulates from that. So that's exactly the connection with fascia in Chinese medicine.
Yeah, so exactly what David was saying now. You can see this is a transverse section of a body. It's painting, but you can see, take a minute. You can see here that, well, this is the rectus abdominis. Okay, this is the erector spine. You can see all the fat. You can see the layers of the fascia. It's all the white thing envelopes the muscles here, and it's the same material that goes around to the back, and then you can see the same. It's envelopes the muscle of the back, but it's the same material that goes inside, envelopes the kidneys and the blood vessels and the diaphragm here. You can see it. It's the same material that envelopes everything. This is painting, but if you open, I don't know, every anatomical book, and you see the cross section, you can see it over there. And if you open a cadaver, so of course you can see it. So you can understand that if, for example, I contract this muscle and the fascia is getting the tension from the muscle, so it changes the tension all around this area and inside because of tension of just one area. Everything reacts to the tension, and then muscles can react differently, organs can react differently. We will see it, okay? But this is just an example to show you the relation and the connection between the organs, different kind of organs, not only muscles, internal organs, blood vessels, veins, bones, everything is in connection with the fascia.
So Gilad, I'm just going to get this just to explain it a bit more. So what you're saying that, for example, if I have, let's say I've overworking of my intestines, of my large intestine overworks, some enlargement, it's going to pull more fascia tissue to there, and then, for example, might cause shoulder pain, for example.
For example, yeah, for example.
Okay,
but
just
usually it's a good example. Usually we are looking for patterns. Like you're looking for a pattern to say, if the shoulder is pain, so probably it's the, I don't know, or something like that. But all around, so you have many options for signs of a problem in different area. Could be a shoulder pain or a back pain or something in my knee just because of stomach issues. But it's not only shoulder. But that's another topic. But yes, what you said is right. So I can see if something inside is having some difficulties, so the tension of the internal organ can influence the muscle system or something superficial, and then we can see it. Yeah.
So the same thing, like in Chinese medicine, when we're looking at patterns, also a lot of times we're looking for the DD and we're looking for the patterns to try and accumulate where it's coming from. So that's the same idea with patterns in the fascia. Press on the, you have to go back to, if you want to move, with the arrows, you can move your slide.
Yeah, okay. So just, it's another example. I don't know what's this arrow. Just an example that I like to give in my clinic. It's very much like an orange. If you see the white material, so this is the fascia, the very, very superficial fascia, but it's also the same white material of the orange. It divides the orange to, sorry, to the, איך אומרים פלחים, David?
Into peels, parts.
Yeah, into the parts, into the peels. But also, if you go more inside, then, sorry, so it also envelopes the small pulps. It's the same in the body. It's the same material. This is the fascia. This is the connective tissue. So actually, if I do a stimulation in the surface of the orange or the body, I can actually, with this small intervention, I can influence some really deep things that go inside because of the connection of things. Okay, so I would like to get to explain some more about how does it work actually. Well, in the fascia, you have it envelopes a lot of areas. Sorry, I will take it again. Okay, it's okay. As you can see, רואים את העכבר שלי?
Okay.
Okay. So this area in the body, it's just for example, because this is my world, this envelopes the muscle or tendons. So this area, muscle, this is the epimysium. This is the very, very superficial layer of the connective tissue. It envelopes large muscles, large areas like thoracolumbar fascia, like the iliotibial band, like a lot of areas. Linea alba also can be one of these. And then underneath it, you can see another layer. So this is the paramecium, actually. This is something that really sticking to the organ, okay? And this is the most important layer of the fascia, because in this layer you can find something very interesting. This one. In this layer you can find something very interesting that you can see in some other fields, like if somebody goes to an operation and the doctor should need to penetrate, or in biopsy, doctor should penetrate an organ to take a biopsy. So the pain is only in the minute when the organ is getting penetrated. But when the needle is inside, there is no pain. It's only in the penetration moment, because in this layer, in the superficial layer of the organ, this is where 90% of the receptors are placed. And they are placed in the fascia. Could be all kinds of receptors, pain and pressure baroreceptors and proprioception, and all kind of receptors that you can think of are placed in the fascia, mainly in the paramecium layer. Okay, why am I telling you this? Because receptor actually, I don't know if you can see, yeah. Actually, a receptor is something very mechanical. It's something like this, that according to tension, it opens or closes, okay? So if a tension, physiotherapist knows it, it's in the Golgi tendon organs and everything. So if there is tension, so the receptors opens and sends action potential to the brain, and the brain understands that something is happening, pain, cold, pressure, whatever, okay? And after the pressure is gone, it closes. This is how we hear, this is how we see. It's receptors, mechanical receptors that move, open or close, and sends action potential to the brain, and it interprets it.
So basically, so what you're saying, explaining here, that if when we do our needling and we insert the needle into the fascia or into the body, and we twirl it or we manipulate it in some way, we cause in the fascia to stretch in 3 levels, from the 3 depths of the level, and through that we cause in a signal to go to the brain and causing the brain to respond.
That and more, because you can imagine that, I don't know, I have, not a shoulder, but let's say I have, okay, shoulder pain, okay? But nothing happened to my shoulder. It's just pain. And even if I touch very lightly, I feel enormous pain. Could happen. You can see it in your clinic. And so nothing happened to the shoulder. I touch it and it's painful like hell. But I know a few weeks ago, I had, I don't know, I took something out of my back in, I don't know, just
An operation.
Yeah.
A wart. Took out a wart.
Yeah, yeah, and I have a scar over here behind. So could be that there is tension that goes from here, from the scar, and pull the fascia over here, the tension, and the receptor getting the tension, and it's shooting pain, or it's shooting something that the brain interprets as pain. And then I touch it and it already opened. So if I touch a bit more, then the pain is enormous. But when I come here and I release it, then the pain, and I touch it after a minute, the pain is gone. You can say that it's neck and shoulder. I can give you some other examples, but it's just an example. So if you
1 minute.
Go ahead.
That's what Gilad is saying here is also a very, very good example, that when we have our patients in acupuncture, we have to look if they have scars in certain areas. And that's why we have all these treatments to open in scars and releasing tension around the scars, is also in some way to release that tension on the fascia and not cause other symptoms that might occur just due to that scar. So he actually gave here the physical, the Western explanation why in Chinese medicine we look so much at people's scars and where they have scars on the channels.
Okay, and even more, you can actually understand why you can treat distance areas, let's say the scalp, and then influence the digestive system, because you can do something here that release the tension, and then the digestive system works differently, just because of something that you did in the skull, in the neck, I don't know where. Okay.
I just want to go back to this question that you're speaking about, the receptors. So you would say that the peripheral nerve system, the sensory part of it, sits all on the fascia?
No,
90% of it?
Not all, not all the neurological peripheral system, but about 90% of the receptors of the free nerve endings of the peripheral nerve system, or it's not only the peripheral, it's also the anatomical nerve system, sits in the superficial layer of the organs. Even the sensation of hunger or fullness, in every organ, the receptors are there, and according to their information, the organs produce hormones or ask for hormones. And yeah, this is what I'm saying. It's the receptors,
So
not. Go ahead.
So the fascia is more the vessel of the peripheral and sensory nerve system.
It's a vessel that really helps the brain to control the system, because it's really complicated system, and the amount of information that the brain gets is enormous. It's almost impossible to handle. So the fascia is like a stupid machine that helps the brain to control the body with tension. Okay, tension is applied, and then things happen. It's very simple and very sophisticated. So it's something really interesting to research. But yes, it's something that it's like a vessel that well, it's a vessel for tension that helps the body to function. Okay.
But it also the fascia also not only has proprioception in it, the understanding of proprioception, but also the understanding of interception is done
Right.
a lot through the fascia. Can you explain a bit more of interception?
You mean interception of functional internal organs?
No, interception is who am I as a human being, that the fascia allows me to communicate also with, I'm a live human being.
Okay.
And if I know this, if I'm aware of me being aware that I'm a live human being, I feel better. Even psychosomatically, I feel better.
And I understand what you're saying. Well, this is something that I really like to explain in my clinic, especially for hyperlaxity people. Try to understand what I was saying just now, and think about somebody that have a lot of relaxin in his body, like hyperlaxity people. So if the fascia, actually all the connective tissue is very loose, is very soft, then the tension on the receptors is very low. Okay, so if a receptor should act, it should act right on time. But if there is a lot of relaxin, so it takes a lot of time for the receptor to move. So it's like, it's in slow motion a little bit, because tension takes time to reach the receptor. So you can see a lot of time. You can see people with hyperlaxity sits in very strange way, like I can't show you right now, but the legs is like that, and the people are like that, and they sit all kind of ways that actually what happens that they tense their body in a way that there is tension on the fascia, and then they can feel where are they. Because if we are talking about, I will try to make it more clear. If we are talking about proprioception, proprioception is, I will straight a line. Proprioception is the way of the body to know where it is. Like I can touch my hands above my head without looking, because I have an information that says this is where your hands are, and you can touch it without looking. My body knows, my brain knows it. But if the information comes not in the right time, so I will miss. And maybe I will get stuck in my table or in the wall because I have lack of information. So I will try to get this information from the surrounding, or I will get stuck in things, or I will try to make more tension in my life, to be more tense, or to do like this, or to sit in some strange ways, or to walk in some strange way, and then I will have more tension on my system, and then I will know, okay, I'm here. If before I was a bit vague, because the information, it took time for the information to reach the brain. So now I'm making like some kind of compensation to say, okay, I'm walking like this. Maybe it's strange, maybe it doesn't look so good, but I know where I am, so I'm happy. It's good for me. So for some people, you have to tense the fascia some more. For some people, you have to contract it some more. but it's something that really, the tension of the body really helps us to understand where we are and where are we. And then you have like a self feeling, okay, I'm here. And this is something with a lot of value for us as people, to understand where are we and to feel ourselves. And this gives a lot of, how did you call it, David?
Interception.
Interception, yeah. Good
So,
interception.
so even by saying that, you can understand that, again, when we speak about channels, we understand that channels don't only have a physiological effect, they also have a mental effect. So we understand how also the fascia connects also to a mental effect on the patient as well, what Gilad just explained. So again, we have in the channels, we have in the planes that the channels run in, and then again, we have in the physical effect on the channels, the connection with the nerve system. Again, the connections, with connections also outer connection with any sensory output coming inwards from not generally only from the body. And then we also here, we speak also about the emotional side, which is also connected to the same understanding of fascia. So again, another connection with Chinese acupuncture and channels.
Yeah, I think that...
it's only one part of the channels. The channel is also blood flow. We're just speaking about the nerve and the fascia right now.
Yeah, actually blood is also connective tissue. So it can also be connected.
Okay, great.
Yeah, but as you said, for my understanding, fascia is like, well, if you're speaking about the internal interception, it's like if we are body and spirit, let's say if it's not one, if it's two things maybe. So maybe the fascia for me is like a connective thing that connects, makes a bridge between the two parts. And it helps because we cannot, we are bodies also, it's not only spirit. So it's like something like an instrument that helps us to connect the two things together, at least from the physical part of the picture. Okay, so as we were speaking before, the receptors are in this layer called the Paramecium, and not in the Epimysium. And the reason why I'm telling you this is because the Epimysium, the very superficial layer, it ends in the end of the body, in the wrist, and in the ankle, and in the neck. It doesn't go further. I will show you it. David,
Matt, you trying to change the slide, just go with the arrows.
No, that's okay. So the very superficial layer that have less less receptors ends here, ends at the retinacula of the wrist and the retinacula of the ankle. Actually, there is a fusion over there between the Epimysium and the Paramecium. Okay, these two layers, this layer and this layer, are fused together here, and from this point on, you have only the deeper layer. I would ask you why, but I think you can understand that actually in the palms and in the feet and in the neck and head, you need more sensation. So you have over there only the deep layer that have more receptors, and then we can feel more. This is why we have more sensation in the hand, in the palms, in the face, in the neck. And I think this is another reason why scalp acupuncture could be very beneficial, like give good results. If we're speaking about the head, so you have, if you know the Galea capiti, this is the fascia of the skull, and it's very superficial. And if you can see, it's really above all the system, and you can imagine like a marionetta, like a puppet with the strings. That if I move the neck, so it tense all the fascia that goes down. So with movement of the neck, of the head, with changing the tension of the Galea capiti, of this fascia, I can influence the other parts of the body. Even more, as newborns, as babies, actually our first movement, except for breathing, our first תנועה רצונית, movement that we want to do, not that happening like not automatic movement, is the suction, is the not reflex, יניקה.
Suction.
Yeah, the suction, and the suction is something that goes from the mandibula, and it's all this area that starts to move, and from this movement of suction, we can start raising our head up, and then we are going up and up and up and develop our movement. So the area of the head is very, very important to deal with when you are trying to look in a general and broad perspective of the body. And it's a really important area to deal with. Even in my practice in fascial manipulation of Luigi Stecco, this area is full of points to treat, more than every point in the body. And it's very complex, and most of the practitioners doesn't go there because it's too complex. So it's really, really important, and I think what you are doing is really important really important treatment and method to try to help people through this. Another explanation for this is actually the cranial nerves. If you all know them, I guess you all know them. Cranial nerves are nerves that goes through the central nerve system to the body, to the face, to the taste, to the eyes, to the ears, and also to the autonomical system through the vagus nerve. And phrenic nerve is not cranial nerve, but it also goes through the neck. Also, the glossopharyngeal, it gives the sensation and taste in the mouth, goes to the pericard, and it helps to regulate the vagal tone and digestive system and breathing and everything. So dealing with Y.N.S.A, the scalp acupuncture, the influence is could be very, very big on a lot of areas in the autonomical system, which gives also internal and external influence on the body.
So if we see here in Gilad's picture, we see the picture on the right, you can see all the nerves, or the nerves from the cranial nerves in this area, and you can understand this area is actually all the effect of in the temporal region. We have the effect by needling these areas. You have the effect on the channels and the organs in the scalp acupuncture of Y.N.S.A especially. Also, you have the motor and sensory line from the Jiao style of scalp acupuncture. So how much information through stimulating what Gilad just said with the fascia in this area, that you affect the organs and affect the channels and affect the cranial nerves. And if we go back, go to Gilad's picture, go back to Gilad's picture, then we have also in the anterior aspect and posterior aspect, how also needling through the scalp, you affecting all that fascia that goes right down the spine, right down to the coccyx area. So this is why scalp acupuncture works in this manner, in my opinion, through the Y.N.S.A. It's connection with the fascia, connection with the cranial nerves, connection with the spinal cord, and it runs right down the tender muscular meridians in the Chinese medicine, why it's so effective with the Y.N.S.A. Oh, can go back.
Okay, so another thing is to understand, well, actually David was talking about it, is that fascia is actually a vessel that allows tension to move from one place to another. Well, actually, it's a channel of energy that moves. It's a kinetic energy that moves from one place to another. The same as muscle. I contract my muscle, the tendon getting short. This is fascia. The tension goes through the tendon to the bone. It's an energetic movement of kinetic energy, but it's a line of tension, a line of energy that goes, but the name is kinetic energy or a mechanical energy, but not chi. So it's another explanation for the same thing, but through other words. This is mainly what I wanted to explain to you. I can explain a lot more on the movement system. It's much more complex, and my understanding is much more deep in this area. But if I try to make the connection between fascia or between acupuncture to Western medicine, so this is where I see a really big connection through the fascia and through what I try to explain right now. I think that there are many applications that you as practitioners can try and discover, because it's a really not fully understood world, and not everything is discovered yet. For me, it's like after I studied for the first time or for the first few times, it was like somebody telling me that there is another continent in the universe, in the world. It's like there's a sixth continent, or it's like people, for me, it was like understanding there is another organ that we are not dealing with, or another way of thinking and understanding things that we are not using. And so acupuncture is excellent. Also, I can understand why practicing yoga or running or pumping iron or doing some more things with the body can influence all the system. Even when I wake up in the morning and I stretch, I do something very important for the body. The body do it automatically. It's not without any reason. The reason is because the system asks the body to open and then to start the morning, start activate. You can, if you look through these eyes, you can see a lot of interesting things, and you can, of course, understand in an anatomical and physiological words how acupuncture actually works and how does it influence the body. So for me,
I just want to go back, Gilad, to take it just into Y.N.S.A. I always said in Chinese scalp acupuncture, it is what was always said, that it is necessary to manipulate the needles, or with electrostimulation, or to come back and manipulate the needles to get a better and better effect. Yamamoto says it's not necessarily to stimulate the needles, because he keeps speaking about that it's not necessary because you always move in your face muscles, and that's actually stimulating the muscles. So I can understand this from what you said when the sucking of like in breastfeeding, that this is developing in the scalp, the twitching. Can you just explain just a bit about that to give an explanation why? What happens?
Well, it's, if I understood what you're asking, it's very similar to what I said about people that goes like this, or if I see somebody with a twitch in the eye, or a face that is half like this and half like this. So for my understanding, is something that is it's functional. It's not. It's something that helps his system to function better. It's not something wrong. It indicates that there is a problem, but the problem is not the twitch. The problem is not the posture. Could be, but for this conversation, the problem is not the symptom that we see. It just indicates that there is a problem and the body tries to solve it. And so if I twitch my eye, I tense the fascia.
So by tensing fascia, I'm stimulating the needle.
Something inside.
So by tensioning my eye or
sorry?
moving my face movements, I'm manipulating the needles, manipulating the fascia.
Yes, you can do that, definitely. So yeah, definitely. But you can, again, from my perspective, if you do it if you have a needle in the scalp and you do something in the face, so of course, yes, you can manipulate the point of needling. But even more, I would take it even bigger. You can do something, tense the arm and move, the palm, and the tension can go here, and you can play with it. It's not only the face, but of course, if it's closer, then the tension should be over there more easily.
So that's also a good explanation. Remember, when me and you started out, we worked on a patient together. Before you were just done physiotherapy. He was a patient who had an accident, and we used to do the needling at the same time, do physiotherapy or some practice. So maybe that was one of the causes why we were getting better results, because he had the needles in and he was moving his body when you're thinking back. And by moving the body, you again stimulating the muscles and stimulating the fascia, and then actually keep stimulating the needles in a certain area and getting a better result.
Yeah, definitely.
So that's also explanation why I always say that when you're doing Y.N.S.A or any scalp acupuncture, in general, we can also understand in body acupuncture what's very, very good, if it's possible, to work with the patient at the same time to make movement, because you're going to get a better response.
I think that it's good to observe this thing, because it's something with a lot of potential. And I think it's very good to try carefully and observe changes. And then you can understand, even if the change is for the worse, you can understand that there is a change. And maybe you can do something the opposite way if you see a change that goes to the wrong way. But it's not always for the better, but always look for the change when you do something like that. There's a lot of things to try and to observe.
We have a question here, Gilad, on this subject that says, so if some people stretch their muscles during the day, they feel more relaxed doing it, especially around the neck, shoulder, and back. Does it mean that after treatment, they will stop doing it?
It's a good question. I think that the right answer is depends for the reason that this person stretches along the day. Because if he's somebody that sits in front of the computer all day long, so I guess that the posture of the sitting in front of the computer is something that makes a lot of tension to the neck. And after treatment, doesn't mean that the problem disappear. The problem is sitting for long hours, and the treatment won't stop the problem, but probably after treatment, it would come back to you and say, you know, I'm sitting the whole day long, and instead of every 15 minutes, trying to stretch myself, I realize that I do it every 2 hours. So I feel better, yes. But the problem is not gone. But the treatment can help to regulate the tension of the fascia. I hope.
So he needs to continue afterwards to do some practice a bit.
I think that balance is is a key word. You need to be balanced in tension and in contraction, sitting, standing, walking. Yeah, and treatments are also something that people needs to do if they don't do it enough for themselves, or in some cases there are situations where a person cannot help himself, needs somebody uh, um, to do something from the outside, just to help the system to get back to balance.
But that the same, if we go back to theories in the past, when someone got injured, the first thing I used to say is let your body rest. Today, the theory is starting to change and saying, okay, get up and start moving and get motion again back into the joint or the area that's been damaged, so, or being hurt, has traumatized, so you can get a better function out. So basically saying you got to continue to work, not only, I remember I used to play tennis, I used to sprain my ankle, my coach said, get up and start working again. Walk, and I used to actually pass with the same understanding that you got to continue working on it. It's not that one treatment will solve it as well. So you have to do practices and things at home as well.
I think that a system that is moving is a healthy system, okay? But if in your tennis course you would break your leg and your coach will tell you to stand on your leg, it won't be a good thing. So I think that it's really good not to look for well, in Hebrew we say a finger solution, like only one solution to one situation. You need to use your head and to understand what is happening and what would be good for this situation. So if you sprain your ankle, so maybe standing on your leg and sending proprioception information to your brain is a good thing. Maybe the blood vessels will take all the swelling of the ankle to the blood system, and maybe it would be good. But in some other cases, maybe it's not the best thing. I think that it's really, really good to be in movement, to move whatever you can. And if you can't, let's say, I'll take your example of the tennis course. If your instructor would tell you, stand up and start playing, David, and you are in too much pain, I think that it would be good if you would sit, but try to move some other things, okay? And then you can influence your ankle through other areas, through the hip, through the knee, through the lower back, and also do some other things like ice and things like this. Okay, so movement is good, but depends where and how.
Okay, so anyone, Siamti, you finished, Gilad, or see if there's questions?
For me, this is the main thing. If something.
So, any questions, guys? So wait a minute. If you have, you can even raise your hand. Okay, so wait, we have, thank you very much, Gilad. It's an honor for me every time. If I don't see you, because we're in Corona, each one is in his own house, so it was great seeing you on Zoom. Thanks a lot. Really broadened my mind, even with little questions. I hope it broadened everyone's lines. Like I said, Gilad and me have been, since 40 years, we've known each other. And a lot of my patients, he's the one, I always, his diagnosis for me is actually sometimes a lot more important than, I would say, other physicians sometimes, and I very respect his diagnosis, and I use it a lot. Gilad Zelinkovsky, thanks a lot. It was great, an honor. Thank you for doing it.
Thank you, everybody, for your patience and trying to understand me. And I hope that something went through. So thank you for listening, and thank you for the opportunity. And in some other time, I will tell you some funny stories about David when he was a child. Okay. See you, and thank you. Thank you.